Did you know that nearly half of all people living with Parkinson's also struggle with anxiety or panic attacks? These symptoms can be just as challenging for you as your tremors or your stiffness. Today, we'll uncover some research and what it says about anxiety and Parkinson's disease. And then I'll share some natural strategies that may bring you some relief. Hello, everyone. It's Dr. Tidman. Welcome back to my channel. Here on my channel, I focus on science-based, natural approaches to managing Parkinson's disease, improving brain health, and other health-related conditions. In this video, I'm going to review a 2021 study from the Journal of Clinical Medicine entitled Prevalence and Clinical Correlates of Comorbid Anxiety and Panic Disorders in Patients with Parkinson's Disease. Let's dive in, but remember, the information on my channel is for educational and informational purposes only. Please consult your own medical team if you have a need to change your medications. This study, led by Elefante and colleagues, looks at how common anxiety and panic disorders are in people with Parkinson's disease. What they found was rather striking. Anxiety is one of the most frequent non-motor symptoms that patients report who have Parkinson's. In fact, it affects anywhere from 30 to 50% of all patients with Parkinson's. Even more important is that anxiety is often underdiagnosed and undertreated. Many patients, even doctors, focus mainly on the motor symptoms like tremor and rigidity. But the study emphasized that anxiety can significantly reduce your quality of life, increase the stress on caregivers, and even worsen your motor symptoms. And I'll bet all of you listening with Parkinson's who have problems with anxiety would agree with these findings. You could probably tell a lot of stories on how your anxiety affects your quality of life, your willingness to socialize, to get out in the community. When anxiety is high, you don't want to be around people, and I totally understand that. So, anxiety happening in Parkinson's disease isn't just about the psychology or necessarily about how life is affecting you. It's really related to the major neurotransmitters in your brain that are disrupted or dysregulated. You've heard me talk about dopamine, and we know that dopamine is affected in Parkinson's, but also serotonin and norepinephrine, which are the brain's mood messengers, are also affected in Parkinson's. In addition, certain brain regions involved in regulating your fear, your reactions to stress, can also trigger panic attacks. So anxiety in Parkinson's isn't just psychological, it's biological. So what are some approaches you could use to start addressing your anxiety? These are just a few. Movement and exercise, walking, tai chi, yoga, any kind of movement that gets the body relaxing is also a great approach. Stress reduction, mindfulness training, meditation, deep breathing, relaxation techniques, and prayer. These are also important strategies for managing your stress and your anxiety. And then, of course, you've heard me talk about this a lot, your nutrition. My friends, you cannot hope to reduce your anxiety when you are consuming high anxiety causing, high inflammation causing food substances. To reduce your inflammation, especially in your brain, which are related to anxiety and panic attacks, you need to increase your consumption of omega 3s. This is fish and seafood. If you can't get high quality fish and seafood where you live, then consider taking a mega dose omega 3 fish oil supplement. Research lately has indicated that fish oil, rather than krill oil, is much higher in the brain loving DHA and EPA elements. So look for omega 3 supplements that are high in DHA and EPA. Try to get 3,000 milligrams a day and see if this doesn't benefit your brain. Magnesium rich foods can really help. And if you can't get quality foods, magnesium supplementation with magnesium glycinate, which is a bioavailable form of magnesium. Now you'll have to read the label, because even though the front of the bottle says 400 milligrams of magnesium, turn to the label. It will tell you exactly how much magnesium is in each tablet. Try to get 400 milligrams of magnesium 2 to 3 times per day. For those of you who also have restless leg syndrome, in addition to your Parkinson's, sometimes magnesium will help reduce your restless leg symptoms at night. Some research has indicated that green tea, which is high in antioxidants, can also help. But be aware, green tea has caffeine. So caffeine for some of you may actually increase your anxiety or the frequency of your panic attacks. And then, of course, on my channel, there are many videos on the low-carb ketogenic nutritional approach. We call this therapeutic ketogenics or therapeutic carbohydrate reduction. Reducing processed foods, grains, high sugar foods, sugary juices, sodas. This will also reduce the inflammation in your body and your brain and may bring down your anxiety. Social and emotional support, support groups, even Facebook support groups. There are many Parkinson's related Facebook support groups. I know, I've been on all of them. Counseling to address your anxiety. Really encouraging friendships and social connections. Share with your friends the problems you're having with anxiety. Talk to a counselor who specializes in relaxation techniques, who can help you with some methods to reduce your anxiety. Believe it or not, structured routines, which bring a level of predictability to your day, can really reduce your stress. Many of us, when we're stressed, get out of our routine. So going back to a daily routine, waking up at the same time, getting out of bed, doing the same activities in the same order, and before bed, doing the same activities in the same order to get ready for bed. These structured routines can reduce uncertainty They can reduce insecurity and improve your reactions to stress and anxiety. Sleep hygiene, I've talked about this on my channel. Consistent bedtime. Limit your caffeine intake. Stop looking at any kind of screens or digital media or even television within 2 to 3 hours of your bedtime. Read a book. Listen to music. Even listen to a book on a CD or on an app. This is very relaxing before bed. And then holistic care can ease your motor and non-motor symptoms. What is holistic care? This is addressing all areas of your lifestyle. Your sleep quality, your daily exercise routine, your nutrition, your mindfulness or the things you meditate on. Turn off all those screens of what the bad events going on in the world today. You don't really need to watch those. I myself, true story, when the pandemic hit, I went on a news fast. I have not watched a news broadcast since 2020. This is now 2025. And I have found I don't really need to watch all of that. So think about holistic care. Care that you can give your body and your brain to reduce your level of stress. The researchers in this study found that this makes a huge difference in the number and frequency of your panic attacks and in your general overall anxiety levels. So remember, anxiety and panic attacks are common in Parkinson's. 30 to 50% of you suffer from these. They're part of the disease. They are biological, not just psychological. Natural lifestyle strategies can help restore calm and improve your quality of life. These strategies include social, reestablishing a daily routine, exercise, meditation or prayer, and sleep hygiene. All of these things will make a big difference. Don't forget your natural nutritional strategies. Reduce the processed foods and high sugary foods in your diet. Eliminate grains, sugary juices, sodas, caffeine, anything that heightens the level of inflammation and irritation in your brain. And remember, you are not alone. Get yourself to a support group of people with Parkinson's. Sign in to some of the support groups you find on Facebook. They're very helpful for sharing ideas about how to deal with your anxiety. This is the reference to the Elefante article I was reviewing. Thank you for stopping in. If you found this video helpful, give it a thumbs up and share it with someone who may be suffering from anxiety and panic attacks. And then also those who you know with Parkinson's who also suffer from these symptoms. Don't forget to subscribe to hear more natural science-based strategies for Parkinson's and brain health. Remember, you're not alone. And there are ways to live better with Parkinson's. See you on my next video.